Hello everyone, my name's Laura. I'm the Clinical Development Manager for ECG and I am here today to provide this pre-recorded webinar for you to discuss the top-up for the Paediatric Basic Life Support, and this is in addition to the article that you would have received. And this top-up refresher webinar solely focuses on COVID vaccinations. And this webinar is founded on the core skills for immunisation and clinical process and procedure elements of the competencies required from Public Health England COVID-19 Vaccinator Competency Assessment Tool. Okay, so the basics of what we're going to be covering is, like I said, it's for those vaccinating 16 to 17-year-olds for COVID, and they require those vaccinators to be at level 2 standard in Paediatric Basic Life Support. So this course is for anyone who will be vaccinating the under 18s and require the Paediatric Basic Life Support level 2 top-up information. So you'll have obviously currently completed the basic life support requirements of vaccination set out by the National Minimum Standards for core curriculum for immunisation training for healthcare support workers. And this would have been either via your online vaccination training with ECG or with the face-to-face ECG training. So this is just a top-up of what you've already learned and practiced and demonstrated from your face-to-face and online training that you've already done. So the content of what we're going to cover today is to be able to recognise and manage choking, understand the roles and responsibilities in responding to persons in emergency situations, understanding individual responsibilities in reporting and recording details of an emergency event accurately, understanding the importance of undertaking any resuscitation interventions within the limits of the personal capabilities and context of any previous training received, and know how to apply the local do not attempt cardiopulmonary resuscitation policy within clinical context. Obviously, you need to be aware that where you need to gain this information for the COVID-19 vaccination advice, and there is a list of resources, and you should always check that you're adhering to the most up-to-date guidelines, as it is always changing. First of all, we're going to talk about choking. So choking happens when someone's airway suddenly gets blocked, either fully or partly. If it's a mild blockage, they may be able to clear it themselves by coughing, but if it's severe, they will need help. Choking is potentially life-threatening as it cuts off oxygen to the brain, so early interventions can be life-saving. If someone is choking, they may be clutching at their throat, they may not be able to talk, have difficulty breathing, not be able to cough effectively, look red in the face initially, but then become blue around their lips and become unresponsive. So it's really, really important that you quickly administer the correct interventions to help the person that's choking. So there are two types of choking. There's partial obstruction. So this is if the airway is only partially blocked, the patient will usually be able to speak and may be able to cough it out themselves. There's also full obstruction, and this is if the airway is fully blocked and the patient will not usually be able to speak, and without help, they will eventually become unresponsive and not breathing. So, as you can see, this is the algorithm for managing a choking adult. In the next video, I'm going to show you how to treat a choking adult, a choking child and a choking infant, and then we'll come back and finish the rest of the webinar after we've finished the practical part. So this will be on the next video.